Assalamualaikum everyone. Welcome to the final end of your first year MBBS, your final block, the block 4. I hope everyone is doing well despite our challenges. So my lecture will be on cancer chemotherapy. Okay, this is the learning outcome of this lecture. You are required to know what are the principles of cancer chemotherapy, classification of anti-cancer drugs, the mechanism of action, the clinical uses and adverse effects of anti-cancer drug groups, which include alkylating agents, antimetabolites, microtubule inhibitors, anti-tumor antibiotics, hormonal antagonists, and miscellaneous anti-cancer drugs. We will also look at the targeted therapies in cancer and clinical implication of anti-cancer drugs. This is the outline of my lecture. We will start with introduction, followed by classification, drug groups, and clinical implications. We will start with the introduction. Okay, what is cancer? Okay, cancer is a disease of cell proliferation. Okay, the normal cells will proliferate or multiply uncontrollably and transform into abnormal cells by genetic mutation. These abnormal cells will spread within the body's own cells. Now, neoplasm is a mass of tissue formed as a result of abnormal cell growth. And these neoplastic cells will compete with the normal cells for energy and nutrition, and resulting in failure of normal organ function. Chemotherapy. Chemotherapy is a category of cancer treatment that uses one or more anti-cancer drugs. Specific chemotherapy drugs will have specific mechanisms and selective toxicity for that particular cancer cell. Cancer is a disease and it is very much similar to infective diseases. It can be cultured or transmitted by inoculation. However, cancer chemotherapy is not as successful as antimicrobial drugs or antibiotics because the drug target selectivity is more difficult in cancer, and cancer is a very complex disease. From making diagnosis to staging, usually there will be delay in starting the treatment. The treatment of cancer involves surgery, radiotherapy, and chemotherapy. And chemotherapy is usually started after surgery or radiotherapy when metastasis has occurred. Cancer chemotherapy can be curative in several cancers such as cancers in children. Some of the examples are acute leukemias, Wills tumor, and Ewing sarcoma. It can also be curative in choriocarcinoma, the cancer of the uterus, and Hodgkin's lymphoma. In a more advanced cancer, such as in the breast cancer, ovarian, endometrial, and prostate cancer, chronic leukemia, head and neck cancer, and lung cancer, chemotherapy relieve the symptoms and act more as a palliative or palliative care. And chemotherapy is less sensitive in much more advanced cancer, such as cancer of the GIT, the kidney, renal, or lung cancer. Briefly, we look into the pathogenesis of cancer. Okay, it takes place when the cells or the genes are exposed to chemicals, viruses, and radiation. This gene and environment interaction is also known as epigenetic. The acquired or inherited mutations can lead to uncontrolled cell proliferation or differentiation. Thus, there will be development of primary tumor. And this primary tumor can develop into secondary tumors when the cancer cells grow and metastasize. An understanding of the cell cycle is very essential for the rational use of anti-cancer drug. This diagram shows the phases of the cell cycle in a normal cell. You may watch the given YouTube link for further explanation on the phases of cell cycle. But briefly, the first phase of the cell cycle, G1, starts with the cell growth. Then, the S phase is where the DNA replicates. Next, the G2 is the second cell growth where the cell prepares for the mitosis, which is the next phase. M. The cell will divide and it will enter into G0 phase when the cell is resting and not dividing. It is very important for you to know the cell cycle because the mechanism of action of most of the chemotherapy drugs takes place or targeting at specific phase of the cell cycle. There are 5 main principles of cancer chemotherapy. The first one is to achieve total cell kill. This is aimed at destroying all the malignant cells and leaving no more cancer cells. This will help in early recovery, prevent relapse, and prolong the survival. Secondly, early diagnosis and early treatment. Aging cancer cells are less susceptible to chemotherapy. This is because there are increased cell division and cell death. So, starting the chemotherapy early will help in faster cure. Next is combination chemotherapy. It is very essential because, as we know, drugs have different mechanism of action and act at different site of action. So, by combining the chemo drugs, it will reduce the complication of drug resistance. Next, intermittent regimens, or an example of pulse therapy, whereby we give high dose of chemotherapeutic regime within a short period of time, intermittently and not continuously. So this will allow time for the damaged normal host cell to recover. And lastly, adjuvant and neoadjuvant chemotherapy. Adjuvant chemotherapy is a chemotherapy given after the surgery or radiation to prevent secondary metastasis, while neoadjuvant chemotherapy is the chemotherapy given before the surgery or radiotherapy to reduce the size of the primary tumor. Moving on to the classification of the drug. There are 2 types of chemotherapy drug classification. The first one is based on the cell cycle specificity. This cell cycle specificity can be further divided into cell cycle non-specific, CCNS, which kills resting cells and dividing cells, and cell cycle specific, CCS, which kills actively dividing cells. The CCNS include cyclophosphamide, chlorambucil, carmustine, cisplatin, busulfan, actinomycin D, L-asparaginase. For CCS, the chemotherapy drugs that act at G1 phase is vinblastine, at S phase are methotrexate, cytarabine, 6-mercaptopurine, 5-fluorouracil, hydroxyurea, mitomycin C, doxorubicin, and daunorubicin. At G2 phase, bleomycin, etoposide, topotecan, and daunorubicin. And at M phase, vincristine, vinblastine, vinorelbine, paclitaxel, and docetaxel. The second classification is based on the mechanism at the cell level. So, directly acting cytotoxic drugs include alkylating agents, anti-metabolites, natural products, platinum compounds such as cisplatin and carboplatin. The hormonal drugs include corticosteroids, estrogen, progestin, selective estrogen receptor dysregulators and modulators, 5-alpha reductase inhibitors, and GnRH agonists. Anti-cancer drugs can be divided into cytotoxic drugs, as mentioned earlier, microtubule inhibitors, topoisomerase inhibitors, and hormonal drugs. The cytotoxic drugs are alkylating agents, antimetabolites, antibiotics, vinca alkaloids, taxanes, chemotherapy analogues. I have adapted this slide from Dr. Gulati's YouTube, and he gave an easy way to remember the anti-cancer drug groupings. So the morning is the 3A keeps running after a single C all their lives. They don't get it, they miss it. And what happens at the end? They become MTV clowns. So the 3A are alkylating agents, antimetabolites, and antibiotics. C, chemotherapy analogues. And M, hormonal, TV, taxanes, and vinca alkaloids. Alkylating agents. Mecloretamine, cyclophosphamide, ifosfamide, chlorambucil, melphalan, busulfan, carmustine, lomustine, dacarbazine, temozolomide, and the platinum compound cisplatin, oxaliplatin, and carboplatin. So, alkylating agent has many. C. For antimetabolites, it ends with 8, purine or vin. Examples are folate antagonist, methotrexate, purine antagonist, 6-mercaptopurine, fludarabine, and cladribine. And pyrimidine antagonist, 5-fluorouracil, cytarabine, capecitabine, and gemcitabine. Antibiotics end with bicin or mycin, such as doxorubicin, or also known as adriamycin D, daunorubicin, idarubicin, metozentron, bleomycin, and mitomycin C. Now, for the vinca alkaloids, it starts with vin, vincristine, vinblastine, and vinorelbine. And taxanes ends with taxel, paclitaxel, docetaxel. Chemotherapy analogues end with tecan, topotecan, and irinotecan. Now we look at the hormonal drugs. Okay, these drugs antagonize the hormones such as steroids, estrogen progestins, selective estrogen receptor modulators and dysregulators such as tamoxifen, tauromorphin, and fulvestrant, aromatase inhibitors such as letrozole, anastrozole, azemistane, anti-androgens, flutamide, bicalutamide, 5-alpha reductase inhibitors, finasteride, dutasteride, and GnRH analog nafarelin tutolin. There are also miscellaneous anti-cancer drugs such as procarbazine, etoposide, hydroxyurea, L-asparaginase, imatinib, nilotinib, and sorafenib. Okay, in a normal cell, purine and pyrimidine are synthesized to form ribonucleotides, which will eventually convert to deoxyribonucleotides to form DNA. DNA will undergo transcription to form RNA and will undergo translation process and form proteins, synthesis, which will differentiate, attach to enzyme receptors, or microtubule production. The mechanism of action of some of the anti-cancer drugs, we will 6-mecaptopurine inhibit purine synthesis, methotrexate inhibit dihydrofolate reduction and block the purine and thymidylate synthesis, 5-fluorouracil inhibit thymidylate synthesis, cytarabine, fludarabine, gemcitabine inhibit the DNA synthesis, and chelating agents, mitomycin C, form cross-linking or fragmenting with DNA. Daunorubicin and doxorubicin block topoisomerase function. Vinca alkaloids and taxane are microtubule inhibitors, and protein kinase inhibitors block signaling pathway, the enzyme receptors.